My guest today, for the very first time, is a reconstructive hand and microsurgeon. He practices at the Mayo Clinic. Never had one of those on the exam room before. Brian Carlson, MD, is here with us today. Sir, it is good to make your acquaintance. Thank you so very much for being here.
It's great to meet you, Chuck. Nice to meet you. And thank you so much for having me.
The
Please call me
pleasure's
Brian.
okay, Brian. The pleasure is all mine. I like that. Call me Brian. That means that you're not like all buttoned up and stuffy. It means that we can actually have a good, honest conversation here today. I'm excited about that. Um, I think it's fascinating, though, the fact that your background is as a plastic surgeon, but really, we're not going to talk a whole heck of a lot about that today. Today, we're going to be talking about the benefits of a whole food plant based diet for people living with type 1 diabetes. Before we get into the science behind that, why is this one near and dear to your heart?
Yeah, it's my favorite topic to talk about. Ask anyone who knows me. So I am a type 1 diabetic. I was diagnosed with type 1 diabetes as a third-year medical student when I basically got the classic symptoms of type 1 diabetes. And for those that aren't aware, there's two types of diabetes, type 1 and type 2. Type 1 is an autoimmune disease where your immune system dysfunctions and attacks your pancreas, and you can no longer make insulin, as opposed to type 2 diabetes, which is a little bit more complicated in its etiology, but is a disease characterized by insulin resistance. So your pancreas can make insulin a normal way, but because you're resistant, that insulin doesn't work very well. And so the bottom line with both of those is you have a high blood sugar. So that's the common symptom, and actually what causes a lot of the disease problems in both conditions. So I was a third-year medical student and just got the classic symptoms of hunger, thirst, fatigue, and because I knew a little bit, I tested my own urine when I was working in the pediatric emergency department, and it was full of glucose. And so I went out and told the attending, and she said, "Go next door," which was the adult emergency department. And there I was, without question, diagnosed with type 1 diabetes with a blood sugar of 686, which is very high.
Yeah, that must have come as a shock to you. How long had you been experiencing those symptoms, or did it really just kind of hit you out of the blue one day?
Not out of the blue one day, but I guess I know that it wasn't going on for very long. I was actually on a military scholarship with the U.S. Navy and was on some summer duties and wasn't having any issues, and actually had lab work done. I don't know exactly how long before, but I had lab work done that summer, which was normal. And so my recollection, it was about a month, but things take a long time to reach our conscious mind. So probably what's going on longer than that. It was October that I was diagnosed. And yeah, it was a shock, and it was, I guess I knew something was wrong, though. And it was, whenever something is wrong, it's a little bit reassuring to know that, to get a diagnosis as bad as type 1 diabetes is to receive as a diagnosis. It's nice to know that there's a definable problem and something you can do to control it. Yeah.
And what was that something? What was the initial plan of action after you got that diagnosis?
Well, this was in 1995, and things were a little bit different now. And I was a medical student, which I think led to some assumptions that I actually knew more than I did. But so I was sent home with insulin and a visit the next day with an internal medicine physician, and eventually got with an endocrinologist and dietitian, and kind of a process to figuring out the insulin regimen. Eventually, I was on an insulin pump, which I wore for a number of years. I was told that I shouldn't be a surgeon, and that was my dream at the time. And fortunately, the medical school I was at had a general surgery resident who was type 1 diabetic, and somehow I had gotten connected with her, and that was extremely helpful. and allowed me to understand that I can do that with this disease, and I can, you know, basically just gave me a lot of hope and inspiration that I can do what I want to do still. The recommendations at that time, I think, are important to know. You know, I met with a dietitian, and since we are going to get into food and nutrition, you know, the recommendations were and are to a large degree to do a low carbohydrate diet. That is really the emphasis on trying to minimize the carbs or have a certain percentage of carbs. And then carb counting is and was and still is in my current life to a certain degree, how you know how much insulin to give yourself. So you need to have a baseline insulin and an insulin when you eat to get all those carbohydrates into your cells where you need where it needs to be to work.
Why would somebody tell you that you probably can't be a surgeon if you have type 1 diabetes? I think for a lot of us who don't have that, we're like, well, I don't understand why that would be limiting. So what is the thought process there?
Yeah. I mean, I think, you know, nowadays we know there, you know, with social media and in particular, there are NFL athletes, there are NASCAR drivers, there's people in all fields of, you know, all areas that are type 1 diabetics, and, you know, proving to everybody that you can do anything. I actually did lose my Navy scholarship. I got a medical discharge. And the concern is that, you know, it's really the hypoglycemia. So if your blood sugars aren't stable, you can, even the smartest person in the world is not as smart as the human pancreas. So that you can still, you know, go low, and you're trying to operate within a tight range of normal glycemia, which most, you know, normal people do, you know, with their pancreas does for them. But when you're doing it and trying to factor in all these uncontrollables, it is a little bit tricky. Nowadays, and back then it was safe and that wasn't an appropriate concern, but nowadays we have continuous glucose monitors, which really make that concern, you know, completely not a valid concern, because we can keep an eye on it and have alarms that go off if we get low, or, you know, to try to prevent hypoglycemia. But that's really the concern, is you're going to have hypoglycemia, you're going to lose your ability to think clearly, and that's
problematic.
Not good. Yeah, problematic. Yeah. If you're a surgeon, yeah, potentially.
Yeah. Would you say, in your estimation, I'm just curious, based off of what it was you were just saying, is it trickier to kind of regulate type 1 diabetes compared to type 2 with the standard course of treatment like you were on initially?
I would say yes. I mean, as a type 1 diabetic, you're having to titrate your insulin dosages to your activity and stress, and those things are harder to predict and control. But basically, your activity and your carbohydrate intake. And so, yes, it's tricky because, you know, as a type 2, even though you're insulin resistant, you can go high. You're not. Some of the medications for type 2 diabetes can cause you to go hypoglycemic. That's not that common. But with type 1, it is a real legitimate concern. Yeah.
How long was it before then you started researching whether you could see some benefits by making further changes to your diet, eventually landing on the whole food plant-based diet? And what were some of the obstacles, Brian, that you encountered to make you ponder such a thing?
Yes. So from fast forward for a lot of years there. So I was a third-year medical student. I matched into general surgery, and I did like vascular surgery. That's kind of what I was thinking I wanted to do, and I discovered plastic surgery as a general surgery resident, and I liked that a lot better. It resonated with my personality and you know what I like to do in, day out. And so got through residency, and for me that included 2 years of research 2-year subsequent training in plastic surgery, and then a 1-year hand fellowship. So 10 years total of training for me. And then kids along the way. So had 4 kids, 2 during my residency and 1 during my fellowship and 1 in my first year of practice. So kind of a large gap there. My son, my only son, is the second oldest. He was a freshman in high school and was playing soccer, was getting some palpitations. I went to the cardiology appointment with him, and I had had palpitations in the past myself. I kind of mentioned just to the cardiologist. Of course, it's always all about me as a surgeon. And my son's, his palpitations actually, got their workup and they were fine. I actually got my palpitations worked up. They're fine, benign. But in the process, they said, well, you've been type 1 diabetic now for 17 years. You probably should get a CT scan of your coronary arteries. So I did that, and I was doing basic science research at the time. I had a research day, which meant, thankfully, I didn't have patient care as a part of it, and I was just in my office. I pulled up my images on the computer, and I saw something white, and I thought, is that a lymph node? What is that? This is not my specialty. And so I Google imaged coronary calcification, and the picture looked just like my CT scan. So that was devastating for me. My youngest was 4 at the time. I felt like I'd still, despite having type 1 diabetes, considered myself healthy, thought I was going to live forever. I still thought I was active and kept tight control on my glucose. So this came out of, this was a big surprise for me. And I thought, well, what else can I do? What else can I do? So that day, I got on the internet and I found Caldwell Esselstyn. I had Apple books. I bought his Prevent and Reverse Heart Disease book, and I think I got the CT scan at 7 a.m. By 11 a.m., I had read enough of that book to be a whole food plant-based guy. And that was March 12th, 2014.
Okay, so I mean, as somebody who's in medicine themselves, to have a 4-hour window to read a book and say, yep, this is what we're going to do. I mean, that's got to be some pretty convincing evidence in there. What was it about that book that had you so convinced?
Yeah, that's a great question. Well, one, he's an MD, he's a surgeon. I researched him. He's from Cleveland Clinic. He's not someone, it was pretty clear to me he's not someone trying to sell anything. And the story he told about the patients, they were cardiac cripples. They were no longer candidates for angioplasty, stenting, bypass. And he took them, put them on this nutritional regimen, which, we can talk about. It's a whole food plant-based diet with some, added specifications of really minimizing your fat intake, and they didn't have any recurrence of events. Not only did they not have any recurrent heart disease, which is astonishing for me as a medical provider, where that's unheard of. I mean, you don't get that. You don't get that with statins. You don't get that with Mediterranean diet. I mean, this really gives someone like me hope that this is a condition that I can beat.
How was that transition for you? A lot of people are so nervous going into it, even if they have like the best intentions, like reversing heart disease. They're still a little bit nervous about changing up the diet that they've been eating practically their entire life. What was that transition experience like for you?
Yeah, it's a good question. And there's and as you know, there's so many people have their own history and nuances that make it difficult. So my experience and my personality, I've learned along the way, don't work as a prescription for everybody. But just my nature as a person is I jump in with both feet. I'm going all in, and I'm committed. And that is the approach that I like the best, because it for patients, because it gives them very quickly visible changes that are not subtle. one meal a week or one day a week. Those might be easier technically to do, but they're not going to give you that really positive reinforcement that you can objectively experience in your own body. So that's just been my approach to everything. When I run, I want to do a marathon. I don't want to do a 5K. It's just this maybe an unfortunate glitch in my system. But so for me as a type 1 diabetic, there still is a transition. I still didn't understand what I could eat and what I couldn't eat. The book is great and kind of gives you a little bit of guidance, but for some reason it took me, I don't remember exactly, a week, a month before I discovered beans and rice, which was hard. It was hard to get full. I was losing weight. In the end, I only lost 10 pounds. I wasn't overweight technically, but I was carrying extra fat on my body. I lost a layer of fat, so my appearance did change more than my body weight did. And the very surprising thing that was unexpected, that book is not written with type 1 diabetes in mind, is that I became extremely insulin sensitive. So to the point, I was getting low blood sugar a lot. I didn't know what was going on. I thought, man, did the diet cure me of my diabetes? It seemed like I could eat anything and my blood sugar would still go low. So I just kept decreasing the amount of insulin I was taking. And eventually, figured that out. Now, I would hope that most people that go on this or are listening to this that are type 1 diabetes, know to adjust that. And in a similar way, if you're type 2 diabetic and you make these changes as drastic, like this, go all in, then you probably need to, have some medical supervision, maybe come off all of your medications, which I think is what people like at Mastering Diabetes do. They, if you're going to do a total immersion, you probably just stop those medicines, and you may not ever need to take them again.
I mean, just a surprise. The diet seems to affect the body in so many different ways. 99.999% of them positive, if not more. So that's really impressive that happened for you. What did that do in terms of your athletic performance? I mean, you just said you're a guy that doesn't like to run 5Ks. You want to run a marathon. So you are a fit individual. You do pound the pavement. Did you notice any changes there?
Yeah. So if I can back up a little bit. So when I was life and residency in kids, I played basketball all my life up into college. Then I went to junior college for 2 years, played basketball, went to university and decided to focus on academics and try to get into medical school. And so I continued to play basketball and go for runs. It was nothing too structured or intense. And then when this all happened around that same time, I decided I was going to exercise. Before I'd had a few years before I'd had a radiculopathy, so a pinched nerve in my neck. And that's kind of scary as a surgeon because it was affecting my dominant hand. That kind of went away, but I still had chronic kind of neck and shoulder back pain. But when this happened, so as a part of that, I was told like running probably isn't a good idea for you, Brian. You have some disc disease, and it's interesting that we know that some of this disc disease may be related to some vascular disease, interestingly enough. So I wasn't a runner for a period of time. I would go for the occasional run, but mostly I would do like the elliptical or something like that. So I was on the elliptical doing that. And then one day I was like, I'm just going to get on the treadmill and run. I did that, and I was hooked. And not only that, but my neck and back and shoulder pain, I mean, it sounds some of the results can sound crazy. It can sound like you're trying to sell somebody something when I talk about how the kind of crazy benefits that I saw, but I could run. I had no back, neck, shoulder pain. I was eating 800 milligrams of ibuprofen a day. because of the pain, and that was not in a smart way. I was doing that, without coming off of it, which is never a good idea for anybody. And it just went away. Well, I just noticed one day I was no longer reaching for the ibuprofen anymore. And athletically, I started running. I loved it. And I'm kind of a competitive person by nature. I decided I want to train for a 5K. I did that summer, and into the fall, I did a 5K series. And then I've just continued to train and get better and faster, to the point where, I was an athlete before. And when I was in the military, they have you do a 1.5 mile time trial. And I remember I was competitive back then too. And I ran that in 8:58, which is just under a 6-minute mile. And that was age 25. Fast forward 22 years later, age 47 is the last time I trained for and raced a 5K. And I did it in 17:58, which is a 5:47 miles. So 22 years of type 1 diabetes, heart disease, age, and I'm faster than I was at age 25. Those are objective things that have happened to me that I have no explanation for other than my nutritional changes.
So here's what I'm thinking. You were talking a while back about how astonished you were that you had become so insulin sensitive when you changed your diet. But then hearing you talk about all of these other changes that came with that, I'm thinking, like, isn't the body just equally sensitive to diet overall? If it reacts in such a dramatic way, in so many different ways, it really does go to show how sensitive we can be with what it is that we put in our bodies. Just as, we can develop, heart disease by eating the wrong things, how much improvement we can see, how sensitive we are when we rid ourselves of all of that stuff too. I mean, has that kind of entered your mind as well?
Oh, for sure. Yeah. There's so many different ways to think about that and articulate that. This is clean fuel in there. And the science, the microbiome, the fiber intake, even vegans in this, in the world, in the country, aren't getting what the USRDA is recommending for fiber intake. So if you eat this way, you don't have to worry about your fiber intake if you're eating whole plant foods. And yeah, the body just runs more efficiently. It's objectively, you don't have to believe in it. If you do it, it will work. It's not something you have to believe in. Just put good fuel in your body, and a lot of crazy things will happen in a positive way. Yeah.
And I'm sure that your experience and your enthusiasm has caught the eye of some of your colleagues, the residents there. I know that you get the opportunity to speak with them and have even kind of, I don't want to say convinced, but certainly encouraged some of them to begin eating this way as well. What has that experience been like for them, and how do those conversations even begin?
Yeah, well, I'm outspoken for a long. It's kind of ironic. I'm on this podcast talking about my type 1 diabetes. For the most of my type 1 diabetes life, I did not talk about this at all. Just for the reasons I mentioned about being a surgeon and being type 1, I just didn't want to introduce it. And my colleagues didn't know, nobody knew, some even good friends didn't know. My very, very close friends, of course, knew. And it's really been only in the last 5 years. I've been doing this, eating this way for over 8 years. And in the last 5 years, I realized, I have to be outspoken about this. And my story, I used to tell it without talking about diabetes or the coronary calcification. And it just it's hard for people to understand. So I think honesty and vulnerability are something I continue to learn. And so I talk about it a lot. I talk about not just about diet, but wellness overall, about taking care of yourself and sleep and exercise and all of those things. And, it's just a big part of my life. It is a teaching hospital. I have medical students, residents, and colleagues. And our residency is a mentorship model. So really, when a resident's working with me, they're with me every day, in the clinic, in the operating room, and it's a wonderful way to train and teach and learn. But because they learn a lot more than just the patient care and the clinical aspects and the things they need to know to be a good doctor, but they also learn, personal. They're like family for those few months. And yeah, I talk about it all the time. I give them a lecture every year, basically telling them my story, but going through in detail some of the science. Because I think every doctor, you think I'm a hand surgeon, I'm a plastic surgeon, you go to any grocery store, mall, anywhere, talk to people who isn't struggling with lifestyle conditions if they're eating a standard American diet. This is everybody everywhere. There isn't a specialty that it doesn't touch. And I talk about it, even in the hand clinic, carpal tunnel syndrome, it comes up commonly because we'll review their medicines. They're on high blood pressure or high cholesterol medicines. And there's a lot of opportunity. I have made it a lot easier in my practice. I have brochures. We have dietitians that are on board here. And we've done a lot in terms of patient education. And yeah, so it does resonate with the residents. They're at a different stage of life. It is hard for them. They're working hard and longer hours, and usually have even younger families and different priorities. But if you have enough time with them, I can convince them that they need to be thinking about it already. We know from epidemic or these traumatically killed children that coronary artery disease starts in childhood. So the fact that I had it, may or may have it, and may or may not have been due to my type 1 diabetes. I tend to think it is. It's just the biggest thing you need to worry about as a type 1 diabetic. And but I think that nobody is especially if they're on a standard American diet, they cannot with any confidence tell me they don't have coronary artery disease. And I can do a pretty good job convincing them of that, and then getting them to make positive changes. I think you mentioned earlier about people understanding and then behavior change, and that continues to be a challenge, for patients and friends and colleagues and everybody. That is a big challenge. I just think for also this younger generation, they're very concerned about the environment, as we all should be, and that is becoming more on their radar screen, and that science is also very, very, very convincing. And that's something that can resonate with people. I think if you're super young and healthy, it can be the changes can be a little more subtle, for you and I who lived a certain way for a long time, the changes are dramatic. But if you're young and healthy and eating not that bad, the changes can be more subtle. And so for me, the changes are super motivating. But I do it for selfish reasons? I really have to say no anymore. I do care about the animals. I care about the environment, and I care about people who care about me. And I want to be healthy for them. I want to be my best person I can be for them, and that means eating well and taking care of myself.
It's funny, I always say when somebody brings up, I went vegan for my health, but then it was, really hard not to also gain a keen interest in the environment and in the animals. And, you really do kind of get immersed in all three. But I think what I really want to ask you about as we start to wind things down here, Brian, is, so you were talking about it being hard on the residents with their long hours, those busy schedules. They're just working to the bone. Like, if somebody's on the go, right? And you have duties as a father, you have duties at work. You're an athlete, like it's go, 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 go. So how does one eat this healthy way? Like, what do you do to make sure that you're always eating this healthy diet and not falling victim to the trap that can be grab and go snacks that are anything other than healthy. What advice can you offer there?
Yeah, I think that's a great question. And I have to be a little bit careful because as a type 1 diet, I think that's one of the reasons why the change was easier for me than for other people. Because as a type 1 diabetic, even though the recommendations I don't agree with in terms of low carb, you do learn that food is fuel, and it's no longer something that you can just do without thinking about. Eating becomes a mindful activity. You have to be very aware of what you're eating and how you're eating it. And so that made the transition a little bit easier for me. So for me, I eat a very consistent diet, and it doesn't take me any time. I do all my meal preparation, at dinner time. So my wife and I will usually make dinner together. It doesn't take very long. And it might be something that the kids are eating that's a little bit different that I don't eat, but I basically eat a big bowl of greens. I eat basically what I call a Buddha bowl every day. And that's a big plate of greens with a measured amount of high carbohydrate whole foods. So like sweet potatoes or squash or other potatoes, beans, some things that are going to be high calorie. That's really important for me. Could be whole grains like rice and quinoa. I don't eat a lot of whole grains, but just because I love it's just a food preference thing. But so that's my dinner. That's also tomorrow's lunch. And then after I make tomorrow's lunch, I make my breakfast, which is a big bowl of oatmeal with a bunch of fruit in it, and I put that in and berries, and put that in the refrigerator overnight, and I eat that for breakfast in the morning. That whole process, including the eating dinner time, is probably 90 minutes. Yeah, that's faster, or that's longer than going to a drive-through. And so you do have to invest a little bit, but it can be super simple, super fast. And that's just what I like. You don't have to even, I like to eat the big bowl of greens, and I think it's important for me. I think those are leafy green vegetables are the healthiest food on the planet as far as I understand. And that I want that to be a big part of my diet, but some people don't like that. And there really is there's a whole world of produce out there that is really fun to explore. And I love doing that. I love to mix up the vegetables. I just make sure if it's sweet potato, I know I weigh it and I know how much carbohydrates in there, and I eat this a certain amount of carbohydrates for each meal. But for people without type 1 diabetes, they don't have to do that. They can just eat as much as they want, and that's the beauty of eating this way. I think that it's not I often tell people it's not a weight loss plan. It's not a diet like a diet that you go on and then go off. It's a lifestyle. It's just a healthy way to live. I don't even like really the word lifestyle, but it's just a healthy way to live. In my opinion, the best way to live and the most appropriate way to live for your individual health, for your family health, for the environment and the animals. Yeah.
Yeah. And remember that, exam roomies, the next time somebody asks you why you're vegan, just tell them it's a healthy way to live and leave it at that. They don't need any more explanation. Also want to just kind of circle back. You were talking that it takes 90 minutes start to finish, but that includes the time that it takes to actually eat. So that 90 minutes is not that big of a burden, especially if you just kind of get into that routine. I think that routine here is really kind of one of the keys to make this so successful for you, correct?
Absolutely. Yeah. That thank you so much for clarifying that, because and dinner in my house is over an hour. So it's our social time. We sit and eat as a family. And so I would say that the meal prep is less than 30 minutes. Yeah.
There you go. I mean, you think about the time then that it would take to go to the drive-through. And if you're going to certain establishments, you know that you're going to be waiting there for at least 15, 20 minutes, plus the time then that it takes to drive home. You're talking about more than that half-hour investment. You may even be talking about the full 90 minutes, depending on where you go and how busy the restaurant is. So, I mean, keep that in mind. To me, that seems like a very reasonable thing, especially, you're talking about making sure that your breakfast and lunch are also taken care of in that window too. That's pretty good. I mean, honestly, Brian, that's really good. I wouldn't call that much of an investment, man.
Yeah, thank you for clarifying. It really is not. It really is not. It's super easy. I mean, and when I'm super busy, I can get a box of greens, put it in a bowl, and put some grape tomatoes and beans and salsa. And that may not sound good to you, but for me, that's just great. I love that, and it can be, you could dress that up in any number of ways to make it even better to suit your own. But that's super healthy. They have if brown rice is too much time to cook, they have it frozen. You can, without anything in it, just brown rice. You pop it in the microwave for 3 or 4 minutes, let it cool, and then you have that beans and rice and salsa. That's a tasty meal, and that's a whole food plant-based meal right there.
No question. If are you a kimchi guy? Because I would say swap out the salsa for kimchi one time and give that a try and see how you like it.
Yeah, no, I do that. I eat a lot of fermented different kinds of kimchis. I do with kimchi. A lot of it does have the fish sauce in it, so you just have to. If you make it yourself, that's not an issue. And if you buy it, then just buy not the stuff without the fish sauce in it. Yeah, the fish sauce I don't think adds anything to it at all.
Yeah, the companies have kind of wised up. They know that us vegans, we like our kimchi, so they'll label it really big there as you go to buy it. If you're not making it yourself, it'll say vegan right across it. So don't worry about the fish sauce there. But the final question that I have for you is kind of a curveball one, and it just kind of struck me, given the fact that your specialty. As a plastic surgeon, you work with a lot of people who have had limbs amputated. And I'm just curious, given the fact that you have type 1 diabetes, and we know, especially even with type 2 diabetes, that, there is that increased risk of losing a limb. Is there a connection between the two? Is that why you gravitated over into that arena?
Yeah, it's a good question. Honestly, I think I mentioned it before. I was interested in vascular surgery, which is the treatment of a lot of people with peripheral vascular disease, and actually chose not to do that, even though it is a large diabetic population. But it is interesting that I did kind of come back to that, and I do take care of those patients, and I really do like it. And I think more so now that I feel like I have something to offer. I think adopting this way of eating and understanding the power of nutrition to prevent and reverse these conditions gives me something that I can add to their care that they're not going to get from somebody else. I do get a lot of patients when I bring up this, I'm the surgeon, I'm the hand surgeon or the reconstructive microsurgeon working to save their leg. And I'm the first doctor that ever brought up their diet. And I've had people cry and say, you're the first doctor that ever brought this up to me. And I knew that this was a problem for me, but nobody ever talked to me about it. So, I mean, for me to hear that, it just inspires me to keep doing the work I do. And that is a big part of why I like this part of my practice. This isn't my all of what I do, but it does, make this part of my job more meaningful and something that I feel like I can really add to their care. To be honest, as a type 1 diabetic, I don't fear amputation because, I'm able to control my blood sugar very well and prevent the things that I know that lead to the problems that eventually would lead to limb loss or kidney failure or blindness, which all can happen as a side effect of the type 1 diabetes. So I don't worry about that personally. I just more feel like it's something that I can offer these patients that I know they're not getting from the rest of the system, the healthcare system.
Yeah, I would imagine those thank yous, that gratitude from the patients, with the tears. I mean, that's got to be everything for you, right? I mean, that's the whole reason why you get into medicine. It's to help people and to be able to help them on that level. I would think is probably one of the more rewarding feelings you'll ever experience.
Yeah, absolutely. That's absolutely that's why we do it. And I think that you didn't go there necessarily, but this gets into a bigger issue in the United States, and is that this kind of care is not reimbursed. So preventative medicine, lifestyle medicine is extremely powerful. Dr. Michael Greger talks about, if you could put broccoli in a pill and sell it, it would be the #1 seller for, cancer treatment and everything else, just because it's such a powerful food. But because it is a food and no one can make a profit, it's not understood, and it's not sold, and it's not something even talked about in disease treatment. So we need to do something about that. And just a shout out to PCRM for the work that you all do, that you have your priorities right, and your approach to patient care. And it's the way medicine needs to be done for our future, in my opinion.
And look, you're going to be talking a lot more about this, specifically type 1 diabetes, at the International Conference on Nutrition and Medicine, August 18th through the 20th. And you're teaming up with Cyrus and Robbie from Mastering Diabetes. The name of your presentation is A New Approach to Type 1 Diabetes. And that is exactly what it was you were just talking about. So I can't wait to hear more about it in depth, my friend.
I'm looking forward to it. Can't wait to see Robbie and Cyrus also, and all of you in person.
It's going to be fantastic. Brian Carlson, thank you so much, my friend. This has been fantastic. I appreciate your time.
Thank you, Chuck. Take care.
If your health IQ was a couple of points higher than it was a few minutes ago, go ahead and like this video or subscribe to the YouTube channel. And to take it even higher, head over to Apple Podcast or wherever you get your favorite shows. Look for The Exam Room by the Physicians Committee. Hit the subscribe button there as well and help to make your world a healthier place.